Good morning, everyone. Thank you so much for joining us today for this important conversation. My name is Twino. I'm the chair and professor of the Heilbrunn Department of Population and Family Health at Columbia University Mailman School of Public Health. For 50 years, our department has been at the forefront of conducting and advancing sexual reproductive rights globally. And we have a proud tradition of speaking out against the harmful impact of the Global Gag Rule and conducting research to really document the impact of the Global Gag Rule and mobilize action as well as investment for women's health globally. And we are so thrilled today to be joined by Zamara Foundation, PAI, and MSI Reproductive Choices. They are leaders in advocacy, in global service delivery, and in policy analysis and advocacy for sexual and reproductive health and rights globally. And you are in for a treat today because we have advocate, scholar, policy expert, sector leader to really dive in the expanded Global Gag Rule. We will analyze lessons learned from harmful past policy, examine the potential expansion of the policy under the new administration, and share strategy how our sector can come together to address some of the harmful impact that we are predicting. So before we dive into today's conversation, I'd like to briefly define what is the Global Gag Rule and provide some framing remarks to ground our conversation today. So what is the Global Gag Rule, or GGR? So the Global Gag Rule, otherwise known as the Mexico Policy, was first introduced by Ronald Reagan in 1984, and it has been reinstated by every Republican president since. GGR prohibits foreign government organization, non-governmental organization from receiving U.S. government funding if they provide, advocate for, or refer to abortion services. And while U.S. funding never directly support abortion services overseas, the GGR requires NGOs to agree not to engage in any abortion-related activity, even using their own funds. So that's an important note. And during the Trump and Pence administration, the policy was renamed to Protecting Life and Global Health Assistance Policy. And historically, GGR applied only to U.S. family planning assistance. However, under the Trump and Pence administration, its scope expanded to include all U.S. global health assistance. This expansion encompasses an estimated $11 billion in global health funding compared to the approximate $500 million family planning during the Bush administration. That's a huge increase. So why are we talking about the Global Gag Rule, and why should the global health community care about it? I know our panelists are gonna dive into some of this issue today, but I just wanna kind of provide a contour of what we're facing in the global health sector. So the expanded GGR disrupt health services beyond abortion. It's a FACT program addressing contraception, HIV/AIDS, including PEPFAR, maternal and newborn health, malaria, tuberculosis, and many more. This disproportionately harms women, girls, and marginalized populations, and it weakens global health system, and it impacts countries that receive USG funding. And as the largest funder of global health and development, the U.S. government policy has significant ripple effect across the entire sector. And against this backdrop, we are also seeing some concerning trend. There is a growing anti-rights movement with reactionary coalition implementing strategies opposed to the rights of women, girls, and LGBTQI+ individuals. We are also seeing a decrease or stagnation of official development assistance. Government like the UK is reducing funding or cutting funding for health programs in low-income countries. Philanthropic foundations, while critical in filling gaps during crises, have shown a tendency to shift focus with changes in strategies or leadership. Many foundations in my time who have originally committed to sexual and reproductive health and rights have pivoted their strategy, which creates short-term funding and it's create insustainability in providing services and program on the ground. And I think more urgent to this backdrop is that low-income countries are drowning in debts after the pandemic crisis. So today, around 3.3 billion people live in countries that spend more in debt payment than investment in health or education. That's about 40% of the world population. So looking ahead, it is likely that the new US administration will extend GGR policy to include US NGO, bilateral program, and multilateral organization, which further amplify its negative impact. So while I think this presents a grim outlook ahead, it also calls on the global health sector, government, foundation, and major players to act decisively. More action is needed to protect and advance sexual and reproductive health and rights to ensure progress for gender equity in this new era. So I am thrilled to be introducing our expert panelists who will spend the next 20 minutes really analyzing the potential impact of GGR and through case study, through research, and through global service delivery lens. And then following that, we'll transition to a moderated discussion to explore what's next and how does the sector come together and respond to this new era of GGR policy. So I am delighted to welcome Rachel Clement, Sarah Casey, Esther Kimani, Beth Schlascher, and Nabiha Kazi-Hutchins. And I will introduce them all at the same time, and then we'll go into some of their interventions. So Rachel Clement is the Senior Director of the U.S. Government Strategy at PAI. Rachel advances a PAI goals of universal access to SRHR. And what is really critical for Rachel's work is she's really integrate perspective from lower middle income country to the decision making in Congress and the US administration. So she's having a hard job coming forward. And then Sarah Casey is a professor in PopFam, and she directs the Race Initiative, a global program that improves SRHR in humanitarian setting. She has 2 decades of experience in working to improve availability and quality of SRHR in countries whose health systems are fragile and weakened by war or natural disaster. Sarah also co-led the previous iteration of research on GGR. Esther Kimani is a Pan-African feminist thought leader and the founder of Zamara Foundation, a feminist organization working towards communities and challenge to transform the status quo in global health and development. Beth Schlascher is a Senior Director of U.S. External Relations at MSI Reproductive Choices. She was the Executive Director of EPI 2020 to EPI 2030, where she transformed global partnership, doubled its size, scope, and funding, and ultimately reaching women and girls in 48 countries. Beth had also have experience working at the Department of State, so her perspective will be critical in today's conversation. Nabiha Kazi-Hutchins is the president and CEO of PAI. Nabiha brings more than 20 years of movement building, policy advocacy, community engagement experience in global health. She has dedicated her career to supporting equitable health and social outcomes across many continents. And she's also a proud alum of PopFam. So without further ado, I'd like to welcome Rachel to make her remarks. Welcome, Rachel.
Thanks so much for that helpful overview of the GAG TWI. Although the GAG itself is not new, as you noted, I think we anticipate that the iteration that will come around this time will be. And the version that we saw under the last Trump administration was also greatly expanded from anything that we've seen since it was first imposed in 1984. I think there are a lot of ways that the incoming administration could expand the gag and restrict US funding. And as we saw during the last administration, there's also a high likelihood that what we see at the first pass with the first presidential memorandum or the first imposition of restrictions may not be the final scope of what they attempt to do to restrict rights. I'm starting my little spiel off this way, not intending to scare anyone or to give any sort of finality to what's going to be in the gag. We won't know what's in the gag until we see the details of it. But I do want this community to be stronger in our preparation and our responses to gag so that we can support those who are new either to this sector or to be impacted by the gag. I also want to note that right now we are under the Biden administration, and that until we are, receiving the details from the new administration about the details of the gag, implementers and folks should not preemptively impose the gag upon themselves. In this country, we have one administration at a time, and so I just want to make sure we're kind of all on the same page there. To kind of flip to the next slide. So you went over this a little bit, Twy, but the global gag has been imposed since 1984. It flip-flops by party, which also has devastating impacts because implementers often have to completely shift like buildings, ways of working, scopes of work. A lot of people are forced to choose between accepting US funding or implementing a full set of comprehensive sexual and reproductive rights healthcare. You'll also just notice that the amount of funding that has been affected in the past and that we anticipate being impacted in the future is just enormously increasing over time. What we anticipate is that an expanded gag rule will not have a humanitarian aid exemption. So it would apply not just to development funding, but humanitarian aid. And that there's also the potential for US-based NGOs to have to face the harsh restrictions and impossible choices that our partners abroad have already been dealing with for over 40 years. Under Trump, the first time we saw the administration push the line and just see how much further and further they could expand the gag, starting first with not just reproductive health, but then all of global health, and then later expanding it to the OAS. I just think it's a good practice for us as advocates, implementers, and donors to be aware that this could be expanded beyond anything we've seen before. And then it's going to be coupled with restrictions domestically, such as the domestic gag on Title X funding, the trans gag rule that's been imposed in the last two House SFOPS bills, and just a number of other funding decisions that I anticipate could cause immense harm. Under the next slide. I think the big thing to just recognize is that the gag rule is just the beginning. The US government has long been a leader globally, not just in the amount of funding that we give, but the type of funding and support that we give. And we have long seen ourselves and purported to be sort of this pro-democracy, pro-rights government. If, as anticipated, the incoming administration makes anti-rights agenda the center of US foreign policy and mainstreams it across issues and across agencies, I do think that it's going to be incredibly chilling in terms of being able to speak out against this policy, both here in the US and abroad, and could encourage other governments to do the same. I think we're also going to see us implementing the Geneva Consensus Declaration, a number of other pieces that will undermine rights. And look, I think if the objective is to really promote smart investments, trim excess government spending, the best way to effectuate that is through these reproductive health and family planning programs. Dollar for dollars, these are some of the best investments that we can make. They pay dividends both in terms of the individual benefits and the people that we're talking about that benefit from these programs and activities, but also because of the enhanced economic prosperity, global security, and enhanced health systems globally that we're able to help provide and support. The gag rule disrupts and upends health systems, undermines localization, and the increased compliance burdens alone are going to ensure that more US assistance dollars are tied up in bureaucracy and not care. I think it's also just important to note that there are a number of other statutory restrictions in place. The Helms Amendment restricts US funding from being used for abortion services, counseling, or referral. The Siljander Amendment restricts US funding from being used to lobby for or against abortion. So we will be counting on our partners in government and our partners on the ground to just help us enforce that rule as it pertains to sort of both sides of that equation. And the Kemp-Kasten Amendment is another sort of piece of this puzzle. It's a determination by the president that has only ever been used to defund UNFPA. We anticipate that there will be a defunding of UNFPA and a number of other UN entities and just an undermining of multilateralism generally. We know that, this policy causes harm and that people are going to lose rights available to them in their countries and that services will be curtailed. Abstinence-only programs are going to be promoted. We're going to see an expansion of abstinence-only and sort of natural family planning methods, a real prioritization on sort of who should even be planning families, sort of prioritization of like within a marriage and heterosexual marriages. And probably either a ban on comprehensive sexuality education or a real restriction on that. And that is, as Twi said, just really going to limit what information, what services are offered to some of our most vulnerable populations, including young people. And it's certainly going to lead to an increase in unintended adolescent pregnancies and unanticipated pregnancies overall, and in maternal mortality. And it's going to derail localization progress as we sort of impose this, US will not only on our own funding, but tainting all other funding. So I, again, don't want to paint too bleak of a picture or too much of a darkness as we start this webinar, but I do think it's just really important that folks are aware of what could be happening and to recognize that often what the US government does abroad is sort of a test for what we can do at home. And as many of us have seen since the Dobbs decision, these restrictions on reproductive health care are felt deeply. They're deeply unpopular. In every public polling that has been done about the gag rule, this is not something that most Americans know that we do, and most Americans do not support. I will pass the mic.
Thank you so much, Rachel. And then I think you put a very measured point of view out there is that we need to prepare well for what's coming next, and it's not an alarmist conversation, but it's about preparation for what's next. So I'd like to move on to Sarah Casey, who will share with us some of the previous work where she have documented the impact in multi-countries and what to come next. Sarah, over to you.
Thanks. Hi. Today I'm going to talk a little bit about some research that we did on the expanded global gag rule under the previous Trump administration. Next slide, please. Where we really looked at the impact of the global gag rule on sexual and reproductive health service provision and access in 3 countries with very different abortion laws. So as you can see, Nepal has abortion permitted under a wide variety of circumstances. Madagascar is prohibited with no explicit exceptions, and Kenya falls somewhere in the middle. All 3 countries have the US government as a large, substantial source of their population and reproductive health funding. We worked with local research partners indicated here in each country. Next slide. Kind of overall, methodology, we talked to people in each country, sort of service delivery providers, NGO representatives, Ministry of Health, contraceptive clients in some countries, as well as donor and UN agency representatives. Next slide. Overall, we found that, no, previous slide, please. Oh, we lost a slide. Okay. Overall, we found a number of domains of impact, similar impact across multiple countries. On such as chilling effects, organizations would self-censor or over-interpret the policy to ensure compliance and prevent scrutiny, reduced participation in coalitions of meetings. For example, certifying NGOs were reluctant or unwilling to participate in meetings with organizations that provided abortion, even when those meetings were on another topic. Non-certifying organizations sometimes found themselves excluded from meetings, even meetings that were with organizations, even those were convened by the Ministry of Health. Organizations would stop providing services that were permitted under the global gag rule, such as post-abortion care. We also found a lot of fractured collaborations and partnerships between organizations and then between organizations and health facilities. Would involve the breaking up of many sort of long-standing or trusted partnerships. It engendered mistrust between organizations that maybe previously collaborated on sexual reproductive health issues, disruption to integrated service delivery, where organizations might have found themselves forced to choose between providing, for example, HIV services or SRH services in order to comply with the Global Gag Rule. Also reduced referrals between organizations. So a certifying organization might stop referring clients for non-abortion care to an organization that didn't decline to certify. So for example, they might stop referring clients for family planning to a clinic that also provides abortions. Partners reported that GGR certification or not became almost a larger eligibility criteria than capacity or expertise when organizations were seeking partnerships. It exacerbated existing weaknesses in service delivery and supply chain infrastructure in the public sector in these countries. Loss of funding and partners resulted in people closing down clinics, health facilities. Mobile clinics were either stopped, reduced, or they reduced their frequency or the number of places in which they provided services. The number of staff at health facilities were reduced. And then things like training. So for example, if a staff had turnover, maybe there were no longer trainings on like long-acting reversible contraceptive, meaning that those services now no longer were available. We found, ultimately in all of this, it's the clients that suffer. They had less choice of contraceptive methods, higher costs, services that were previously free, maybe were now fee for service, or they had to travel further and incur higher transportation costs in order to obtain a contraceptive method. We found many more stockouts. Sometimes NGOs would support organizations with sort of buffer stock that was no longer available when there were problems with the national supply chain. And these disruptions really were linked to service delivery impacts sort of across health topics: HIV, family planning, abortion, child health. So kind of overall, actually you can go to the next slide. Global Gag Rule really hinders SRH programs and services, both in countries where abortion is highly restricted and less restricted. And these impacts are far beyond abortion. They really impact these other services. It damages public sector service delivery, and often services that are ones that USAID generally prioritizes, like family planning and HIV. We'll share this after the fact, but we did publish some of the results, including specific results from each country. Thank you.
Thank you so much, Sarah. That was great, just to bring how the policy could impact both partnership on the ground, which makes the sector operate much more inefficiently. And I think the issue you brought about trust is so critical. But most importantly, it's about the client and the services, and it's impacting women and girls, and people need contraception and abortion care on the ground. So I think that was great. And then I think when we are talking about on-the-ground impact, I like to introduce Esther, who's based in Kenya and can talk about her experience as an advocate, as a feminist, working on this issue on the ground and mobilizing government on the continent, but also kind of thinking about how those government and those advocates on the ground can respond to the impact of the GGR. Esther, over to you.
Thank you very much, Troy, for this opportunity. And to start us off so that then I can center, my thoughts, I think I'll speak from the premise of really centering the lived realities of women and girls in all their diversity. And to just paint a picture when it comes to Kenya, when you compare the domestic resources on health and the donor funding that we get, the donor funding constitutes around 50 to 60% of the health budget, with external sources knowing that to play a very huge critical role. And the programs that the external donor funding are supporting is, of course, HIV immunization, tuberculosis, maternal health, and and all this, the support is coming from, of course, PEPFAR, Global Fund, Gavi, WHO, and and more of the funding that is coming from the US. And I remember, when Trump administration reinstated the Global Gag Rule, and we were working on in the community. One of the young women told us that when a local clinic closed, I had no access to contraceptives and had an intended pregnancy. It changed my life. So you realize that, the expansion of the Global Gag Rule, as Sarah has mentioned, and just to dip a little bit further when it comes to Kenya, is that some clinics closed. When the clinic closed, then it means access to contraceptives, access to even post-abortion care was like it was not even accessible. And some of the effects that are, that we saw then, and we are in 2025, we are hoping that we know that it's gonna be massive, is first the fragmentation of sexual reproductive health services. We saw that when they expanded the GGR, what that meant was that it forced organizations to choose between providing the service, including, of course, safe abortion and family planning. And what this means is that then this facility decides, okay, we're going to sign on Global Gag Rule, and that means they're not going to provide these services anymore. So you find that then NGOs that really prioritize sexual reproductive health and abortion advocacy, if you decided to sign on Global Gag Rule, it means that you'll not receive the money that you're receiving from PEPFAR. And the other thing that we really saw at that time was, of course, disruption of coalition and partnerships. What that means, the Global Gag Rule, the policy, it created divisions within civil societies. What that means is that the coalitions that are working towards providing these services, they were disrupted. And some organizations refused to comply with Global Gag Rule, and those that refused to comply really faced a lot of stigma, exclusion from joint efforts, and of course, there was more so a loss of partnerships at the community. And we saw that, some of the organizations that were unwilling to certify the Global Gag Rule, they lost really critical supplies, such as, of course, advocacy work, and even medications such as abortion medications are critical when it comes to abortion care. And we also saw that, which already Troy, you alluded to this, that time, and since 2017 till now, of course, there has been an increased opposition on SRHR. GGR provided that platform for anti-choice, anti-rights movement to really thrive in that time. But also we've seen that with governments within East Africa, and of course, Kenya being really religious, what this has meant is that it really legitimizes the government action and silences on post-abortion voices. So you find that then, the policy and the expanded GGR provided like a home, allow me to use this one, like an environment where anti-rights, anti-feminist movement, and anti-gender movement really thrived at that time. And we've seen consistently, and as we say now, they have a bed within East Africa, and we've seen how they have really moved with, having really anti-choice frameworks that have been enacted in the past few years. The other effects that we saw, of course, we mentioned closure of clinics, and reduction of integrated services. So the expansion was not even just on a post-abortion care. We saw that then for the clinics that had integrated HIV and STI services, some, clinic refusing to provide this care because afraid what it's being linked to even providing the information on care. And, of course, when you think about it economically, the loss of jobs for healthcare workers really affected many organizations because of the funding cut, or young women and girls really disproportionately being affected, especially those living in rural areas. We also saw the expansion that's really bad, even education. So you could not even go to our hospital for you to even get information around contraceptives, and even, information around how you can prevent yourself from unplanned pregnancies. So the expansion of it made it difficult for young women and girls at the community level to be able to access the service. So for me, really, in closing, my submission is that we have seen over the years how the Global Gag Rule has continued to disproportionately harm marginalized communities, women and girls, and violating their rights to health. As an advocate, all of us, we should be able to advocate for or have in place policies that continue to protect, respect reproductive justice, and not just do the opposite. And how do we do that? Is for us to be able to work together in the coming 1 year to be able to find how can we be able to advocate for our governments to increase domestic resources on health, because that means the money that we're getting from external factors is not, it's not going to be significant. And also the other thing is that then we urge all the other financiers that are not from the US to increase the support, so that then the money that we are getting from PEPFAR, Global Fund, is not significantly, means that then, as we know that it's going to be, Global Gag Rule is going to be reenacted next year, then you find that then these services are not going to be affected by any means necessary. So a lot of advocacy, working with our governments, and knowing that even our governments, really are not as forthcoming as they should. That doesn't mean that we should not continue this work, because we should all make sure that then we are working towards respecting and protecting the reproductive justice of all women, all the diversity.
Thank you so much, Esther. I really appreciate your comments around how this kind of the chilling effect of GGR provide a platform for other anti-rights movement to thrive. And we see that in Kenya, in Uganda, in Ghana, and elsewhere. And then your call to action. So I really appreciate it, and we'll dive into that. But now let's take a wider zoom out to go back to the policy and also talk about from a perspective of global health service delivery, MSI Reproductive Choices. So Beth, over to you.
Thank you, Twine, and thank you for hosting this important conversation today. Okay, great. Is the video working? I'll just go forward with my presentation. Okay, so thank you for having us. And for those who don't know MSI Reproductive Choices, we work in 36 countries around the world. And in the countries where MSI works, we are the largest providers of contraceptive and abortion and maternal health services. So MSI's experience is really a bellwether for what we can see might happen in the sector. So next slide, please. What I wanted to share first is just a bit of grounding on why all of this matters so much. As Esther just said, the US is the largest funder in Kenya for reproductive health and health overall. But we're the largest funder overall, with 66% of all overseas development assistance, ODA, coming from the United States. So the policy writers and the frameworks that come forward from the US have a massive impact on the sector and how other partners can deliver health services. This is part of why it's a shock to the system whenever the Global Gag Rule comes back in. And as important as GGR is, and Rachel explained what expansion might look like, we also know that the Global Gag Rule is just a part of a broader effort by Republicans, particularly under the first Trump administration, to expand a different kind of a normative standard and a defunding of the existing system in order to impose their worldview on the rest of us. Next slide, please. So I want to give a bit of background to some of the instruments that were created under the first Trump administration so you can see how the Global Gag Rule fits into a much larger plan. And these are things that have already happened. We'll talk about Project 2025 as well in a minute, but I want to give you a grounding and how all of this fits together. So in 2020, then Secretary of State Mike Pompeo launched what he called a Commission on Unalienable Rights, which was a group of academics and activists and policy experts who came together to consider if, for the US or from the US perspective, the human rights law was correctly positioned. And their determination was, in fact, no, that they felt the US government was overvaluing human rights to the detriment of what they call God's law or natural law. So the Commission on Unalienable Rights creates this different worldview in which God's law is more valuable or more important as a foreign policy objective than human rights law. And then to create a group consensus around that worldview, they crafted something called the Geneva Consensus Declaration, which is a one-page statement that is really an anti-abortion statement and one that promotes a heteronormative framework for families that's exclusive of LGBTQI people and also doesn't consider sex outside of wedlock. And they created this, they launched this in Geneva to give it the impression that it's actually a part of the UN human rights frameworks, when in fact it's outside of normal processes. And then to implement that, when Trump was out of power, the drafter of that, a woman named Valerie Huber, launched her own NGO and then crafted a program called the Protego Women's Optimal Health Framework, which implements the Geneva Consensus Declaration. And many of the activities within this are quite standard and really promote women's health. It's what's not included in that. Again, abortion, reproductive health and care for sex outside of marriage, and again, LGBTQI persons and their needs. So we have right now a global framework, we have an agreement, and we have a program that has continued to move forward by Valerie Huber and others while Trump was out of power as a sort of government in waiting, because we know that Trump is quite transactional in their approaches. And so the sell was really, if you continue to align yourself with this worldview, if and when Trump comes back, then you'll have demonstrated your fealty to this framework and to these ideals, and will be well positioned for favorable status when we're back in power. So these are the kinds of things that we see about to happen again, or to come back in and be the overarching policy for the State Department, particularly if, as we expect, the Global Gag Rule is extended to all of foreign assistance, including with the UN. The last thing I'll mention is this all doesn't just come from the United States. There are other actors within this network of anti-rights coalition that are also putting forward their own objectives, including Katalin Novak, who launched XY Worldwide, which Elon Musk has was there for the launch of it and has put out favorable X tweets about. And this is one that just looks at pronatalism, saying that population decline in the global north is a major issue and should be managed, again, through the promoting of large families and a heteronormative framework. Next slide, please. So Project 2025 itself goes into great detail on all of this. And this slide just sort of moves you through these ideals. The first being, again, that the relationship with the UN should be transactional. You're either with us or you're against us. You either sign on to our worldview or you will not be favored and potentially defunded. We already know that WHO and UNFPA will be defunded because that's what happened under the last administration. And it's fairly routine now, particularly for UNFPA, to pull that funding away. Right now, the US is the largest funder to UNFPA to the tune of $230 million last year. The vast majority of that, $180 million, goes to women who are living in humanitarian crises. We are the largest funder in Afghanistan for women who desperately need services. We're providing $40 million in Gaza. We are supporting Sudan. That money disappears under this false notion that UNFPA is somehow promoting abortion as a lead objective when we all know that that's just a political construct in order to defund these issues. So it will be catastrophic for women in those humanitarian crises and for women worldwide. The last thing I'll point it to is Project 2025, promoting again throughout the document this concept of unalienable rights, which again are believed to have been endowed on all of us when we were born as part of God's law and superseding human rights law. And that they intend to push this and promote it through all of their relationships across the UN. So next slide, please. So for MSI, when the first Trump administration came in 2016, we lost over 140 million or $120 million. And the result of that, because MSI works with mobile clinics and the hardest to reach, and we do a lot of work on health system strengthening, meant that 8 million women went unserved. When these gaps in funding come in, it's not just that somebody else can pick that up the next day. It means that some women won't have services for weeks, months, or years, or perhaps never. And as was mentioned earlier, once you break trust as well, when it's the most intimate service a person can have related to their sexuality and their reproduction, it's hard to earn that trust back again. So these are not fractures in a system that are easily overcome. It takes years and sometimes generations to rebuild that kind of trust. And when MSI lost funding and those 8 million women went unserved, we're able to document that meant that about 20,000 women died in maternal health situations because of a lack of access to services. So this isn't just an academic discussion. It has real life implications for services and for the people that we seek to reach. So for us, next steps are just around understanding all of this and helping other people to understand it too, because it's not rocket science, but it is complex. And you have to see how all of these pieces fit together. But to know enough that this is not accidental, it's intentional, it's well networked, it's well funded, and the Trump administration has a stated intent to move this forward because they've demonstrated to us that they never stopped. So we have to take this very seriously and help those outside of the sexual and reproductive health and rights sector to understand it, because it's now going to be potentially, likely, a part of all foreign assistance. So we're very glad to be in partnership with all of you. And thank you for being here today to learn together and to strategize together about what we do next. Thanks, Troy.
Thank you so much, Beth. I think, I think just really providing the commentary on the 20,000 projected lives that were lost due to the previous administration rule, but also I think what was powerful is the trust, not just within the SRHR sector, but the trust with our community and with the women and girls that we serve. And that trust takes time to build between health system and community. And I think that's a worrying comment that I want to pick out for our audience. I want to go now to moderate the discussion so we can take off the slide and have everybody back into conversation. And I want to kind of introduce Nabiha, right? I'm just going to dive into it. I just think the biggest worry right now across the sector, everybody I talk to, from service provider to scientists to advocates, funding. I talk about how funding, there's a worrying trend in the global health sector overall, a worrying trend. So I think my big question for you is what do the donor community need to do now, Nabiha, to kind of help and support the community moving forward and really kind of not lose another 20,000 lives that MSIs have seen?
It's such an important question, and thank you, first of all, for convening us for this important conversation. I hope everyone can hear me okay. So as it relates to the funding landscape, I think our funding landscape is definitely stressed. There is not only shrinking in civic space, but also shrinking in the funding landscape. And what is concerning to me is the fact that our funding approach is not aligned with an approach that we are is not aligned with what the opposition is doing, right? So the opposition funds long term. They are funding with a very specific coordinated approach to dismantle and derail rights. And as I said, the long view is the view that they have. I think on our end, especially those who are doing advocacy and accountability work, and let's put aside the service delivery piece, because that is also a ping pong effect, depending, at least, as Beth mentioned, depending, and certainly as Esther mentioned, depending on the administration and power, what the whims are of a given administration. At least from an advocacy accountability perspective, we are having to respond with a short view, with a couple of year horizon, trying to activate and demonstrate impact in a short term, when what we are really fighting is a movement and change that has been in it for decades. And so I think, fundamentally, the mindset and the orientation needs to shift to recognize that, it's apples to oranges when we talk about our response, even when we're talking about trying to get ahead of mitigating some of the harm. So that is the big concern. And then the other piece that I'll let you know is, and we've all seen it, is we have the donor landscape additionally stressed because people are leaving. Donors are leaving, champions are leaving and moving to other sectors. And there's a whole host of reasons why, but I kind of look at this and say, the absolute worst time to be doing this. If we can't mobilize and fund something that is so core, not only to humanity, but to the prosperity and progress of all people, just because certain themes might be inconvenient or quote unquote politically not correct, then we're not really leading collectively with the kind of intention to really deliver on those big ambitions that we're talking about, related to gender equality and climate resilience and poverty alleviation. Bottom line is, if you cannot support and fund sexual and reproductive health and rights in its entirety, from service delivery to developing good policies to holding decision makers accountable, then you're not funding what is right for people.
Thank you, Nabiha. I think maybe that's a very strong commentary. Is that, and I would stretch it a little bit. It's not apple to oranges, but it's apple to watermelon, right? And I think people just really need to realize the strategic opposition on the other side versus the scrape that we're trying to do as an entire sector. Now, I think, given what Beth and Rachel and Esther have talked about in terms of this sort of the impending change in the GGR, it's disruptive, right? Many NGO who have spoken out, many organizations who have worked on this issue in the past might not, right? That's the reality of us coming into January, right? Or now. So maybe I'll start with Esther, and Rachel and Beth, feel free to chime in here. Is that, how do we bring together and build coalition? This is your expertise, right? To mobilize coalition, to mobilize partnership. How do we as a community to partner differently? And I would say the global health community often forget that SRHR is essential to global health. So how do we work across SRHR, but the global health community better? So Esther, over to you.
Oh, sorry. Thank you very much. And when I thought about this question, really, and of course, supporting Nabiha's submission, for me, I feel like all the time, within the global health and SRHR movement, we do not make time to have resilience planning in a way that then we are able to really prepare for policy shifts by deeply conducting risk assessments and developing contingency plans for, of course, funding. What we have a funding disruption, what will that look like? And how do we then collaborate with what we already have and ensure then that, in terms of advocacy, in terms of SRHR, in terms of SRHR services, is not disrupted. The other thing is in terms of really building, critical systems, of course, such as alternative supplies for essential SRHR commodities. We know this is like a long stretch, listening to all the presentation, knowing that then, close to half of, government funding is coming from, ODA and PEPFAR and USAID. But then how do we creatively build, systems that then we can think about how does, alternative supplies for essential commodity look like, and where can we be able to get that? And then also, of course, then, the power of community education that we all know, because then one of the things that we usually do, but within this restrictive environment, we need to really think about is how do we then empower the grassroots networks to be able to really provide the immediate support and needs for SRHR, at the community level? How do we ensure there is an existing, empowerment ongoing for example, comprehensive sexuality education, so that then we are able to ensure that we delay the sexual debut for adolescent girls and boys, that then, girls and boys are able to make informed sexual choices, so that then, yeah, hoping, yes, when they do that, then, the need at that time, of course, for services like contraceptives will not be a bit higher at that time, just thinking out aloud. And, the other thing I feel like, we need to be able to get sustainable funding mechanisms. Like Nebia has said, the opposition really fund long term, they have deep pockets, and we have seen over the last few years that we don't have that. How do we, work with, the different organizations or different funders to really create an endowment funds that continues to, we invest in, I don't know if high yield savings account, this is me thinking out aloud, so that then we have income of what we already have. Then what that means is that we will reduce the dependency on, international funding. And of course, engaging other funding sources that we have not invested. And I think lastly that I can say is in terms of really building partnerships that work, partnerships that are built out, out of, respect and really saving the lives of women and girls. And through that, we can find ways where we invest in training healthcare providers who are offering non-judgmental services. We are able to really strengthen advocacy skills for leaders to continue sustaining the work despite the opposition. The truth of the matter is that the opposition is there, they have a lot of money, and we are always caught off guard to really, we're always caught off guard reacting to whatever they have started, and we haven't had time to really have, the partnerships that make sense for all of us, so that then we are not caught flat-footed all the time, that then
Thank you,
we are
Esther.
the ones that are, building the narratives. Thank you very much.
Thank you. I appreciate it. I think a call for building a more resilient partnership and long-term investment is critical. I don't know if Beth and Rachel want to chime in quickly. We're kind of wrapping up soon, so I have one more question. Please feel free just to chime in quickly.
I just wanted to say, let's look for the opportunity here, because our sector has struggled to make connections to other sectors, to humanitarian, education, climate. But now, if Global Gag is attached to all foreign assistance, then suddenly we have an expertise that they don't have. And they're probably going to want to talk to us. How do you implement this? What does it mean for contracts? How do you monitor? So we have a skill they're going to need. And let's use that as an entry point so that when we meet them and say, yes, I will help you with this. And while I'm doing that, I'm going to explain why SRHR is so critical to you in reaching your goals as well. So can we now form a larger partnership out of this because we have a better understanding of one another? So let's look for ways in which this brings some energy back to our side and that we stay motivated as well, because we have the science on our team, right? Those who will be defunded, WHO, UNFPA, IPPF and MSI will never sign, DKT will never sign. There are organizations like PAI, IPAS, Guttmacher, Center for Reproductive Rights. We are an incredible coalition of people who will not be co-opted by the Trump administration. Let's lean into our own power and not feel so sucked down by them because we have the right of science and the connections through the multilateral system to prevail long
Thank
term.
you. Yeah.
You're welcome.
I love it. I love it. I'm a scientist, so thank you for calling out the grounding in evidence that we have. So maybe I'll move to Sarah because I am a researcher at the end of the day. Sarah, you share this powerful data and evidence. MSI shares some as well. I mean, moving forward, it's going to be a little bit chaotic. What kind of evidence or data is needed, and what do you think the future for data and evidence in this new era would be?
So we know that the right wing in the US doesn't really care about data or evidence or facts, but other people do. And I think it's really important for us to research and bring the evidence that can be really useful to bolster national level policy advocacy and movement building. Make sure we have up-to-date research, work with our local partners on the ground, help them to bring together, give them the data they need to sort of push their government to make their laws work to affirm rights rather than restrict them, kind of support local groups who can bring some of these firsthand perspectives and feedback into them, and sort of, make sure that we have the data to respond to questions, to also show, I mean, I think, again, so many people who, care, many people who think about this, who don't really know about it, think that it just impacts abortion services. And so I think it is very important, again, to show how the impacts are so much broader than just abortion, and the impacts on governments and communities and health systems are much broader than they seem like if you just say, oh, it just, stopping people from from providing abortions.
Thank you, Sarah. And Rachel, you work with the government, and I wonder what kind of evidence or data do you need to mobilize kind of conversation even,
That is such a good question. I think building off of something that Beth said, I think there's a great opportunity right now. We've seen in this last election domestically that when abortion is on the ballot, people vote for rights. I think it is deeply unpopular what the administration is going to do is going to be deeply unpopular. I don't think the American public generally understands the gag rule very well or is super aware of it. So I think some of the evidence that we need to bring to the American people and sort of broadly to members of Congress is just on those viewpoints. These are our tax dollars. This is our money that's going abroad, and we should be doing good with this money. I mean, the United States has never given money out of the goodness of our hearts. This is not the generosity of the American people. This is to advance our own interests. And it does not advance our interests to kill people unnecessarily. I mean, what Beth is saying with the 20,000 people, those are preventable deaths. Those are people who should be here today, who should be, family members and community members. And it's a bad policy. It makes our US foreign assistance dollars less effective. And so I think, the individual stories, the people who are harmed, I think they're important. I think we need to keep uplifting them. I think we also have to have a slightly more tactical perspective to just ensure that we're really making sure that this is not effective governance. This is not effective foreign assistance.
Yeah, thank you so much, Rachel. And we have a 20-minute comment from a 20-second comment from Nabiha, and I'll close it out. Thank you.
Yeah, I just want to share that, essentially the rule is if you're doing something with our own money that we don't like, you're not going to be eligible for funding or donations or support. And I can't underscore enough that such a rule in the US would be and is unconstitutional, right? Because in our country, you can't make eligibility of US based organizations for federal funds contingent upon the organization's willingness to give up the right to use their own funds to exercise their freedom of speech. And, the only thing I want to contribute is that the policy Global Gag Rule are maybe views by a small minority, a powerful minority in the US that is out of step, that is trying to restrict rights, is very much out of step with the preferences of the United States and with Americans, because over 70% of people in the United States believe in the right to choose and reproductive health and freedom. And we saw this time and time again. When the issue is on the ballot in the States, people vote to protect those rights for everyone. And if we're going to do that for ourselves and our loved ones in this country, we need to hold our political leaders and those elected officials accountable to ensure the decisions that they influence and make for communities abroad are aligned to what we would want for ourselves in our own country.
Thank you, Nabiha. So I just want to say thank you, panelists. This has been very powerful and energizing at the same time. I think the future looks bleak, but I want to close out that we have the know-how of how to respond that most sectors do not know. We have the science and evidence behind us. We have our coalitions behind us. So I look forward. This is a series of multiple conversations that we need to do as a coalition moving forward. And I'm so pleased that thank you, Zamara Foundation, PAI, and MSI Reproductive Choices for joining us in this effort. And we look forward to partner with you, continue moving forward. And I just want to put out a call to the entire sector, but particularly our donor. This is not time to recoil. This is time to double down, long-term and strategic investment. You have an organization, that you can invest in. So please do. Have a wonderful week, and thank you all for coming. Take care. Bye-bye.